guys, welcome to my YouTube channel. This is your registered nurse Christy. So in today's topic, we're talking about the management, prevention and complications of what diabetes if left untreated, just like I told you in my previous video. But please, if you are new to my channel, I really appreciate you follow me, share and like. I really appreciate that. Now, prevention of type 2 diabetes involves making lifestyle changes that can help to manage the level of your blood sugar. And some effective preventive strategies are: number one, maintaining healthy weight. Maintaining healthy weight involves you losing weight, like doing exercises that can help to bring down some percentage of your body weight. With that, you can reduce the risk of having what? Diabetes. And as well, knowing the type of diet you take. You know, most times, not like most times, you know that weight and food, they work hand in hand. So the type of food you consume determines your weight and vice versa, right? So you should be paying more attention to food that involves vegetables, plenty of fruits, lean protein, whole grain and healthy fats. So with this food, you can curtail your weight. Two preventive strategy is you having regular exercises. Just have at least 150 minutes of moderate intensity aerobic exercises in a week, such as swimming, biking, running down the staircase, instead of doing all those things that you believe you like. Although your hobbies can be okay for those that see hobbies as football, running and swimming. So you can do such type of exercises that can help to regulate your blood sugar, because the more exercise you do, the good circulation you will have. Number three is eating a very good balanced diet. Focus on food that are healthy. For example, food that has fiber. All this food that contains fiber, just like vegetables, grains, nuts, legumes, fruits, all this food that has all this type of fiber, all these fiber containing foods, they can help. And another thing, limit intake of sugary stuff. Limit buying, eating snacks, excessive intake of ice cream. All those things can increase your sugar level. And most importantly, the oil we use, oil such as olive oil that are from the avocado pear and some nuts, those can really be for consumption. Number four is staying hydrated. Staying hydrated can help to boost metabolism and then aids in proper circulation of blood, and in turn reduces blood sugar level. Instead of you taking all this sugary stuff, you can go for water or all these low calorie beverages that are okay to be taken, instead of taking Coke, Fanta, all these things that has high amounts of sugar. Just cut them down, especially when you know that you are at risk of having what? Diabetes, especially those that have the family history. Five is you going for what? Regular medical checkup. Regular monitoring of your blood sugar is okay. Even if you don't get to go to the hospital, we have what we call glucometer. You can go and buy it. Don't worry, one day I will teach how to use glucometer, how to use the strip to check your own blood sugar level. If you don't want to go to the hospital and you feel like it's very expensive, you going to the hospital to go and check your blood sugar level. So especially for those who are at risk of diabetes, ensure to go for regular monitoring of your blood sugar in the hospital or in any clinic. Number six in my plate is managing of chronic stress. You can manage stress through engaging yourself in activities that can help. Number one, yoga, meditation, and even deep breathing exercises. All those things can help you to relax. There are relaxation techniques that can help you to relax yourself when you go through all the hurdles of the day coming back. You understand? So try and engage yourself. Even if it's weekend, you go for yoga and meditation. There are some sites. I even have a friend that does yoga. Like, if you want me to introduce you to her, no problem, I will definitely do that. She will teach you how to meditate so that you can relax yourself, your nerves, and there will be good blood circulation. Number seven in my plate is limit alcohol intake. I'm not saying you should stop drinking alcohol, but the only thing I can tell you is to take it in moderation. Don't overtake it. If there is high amount of intake of that alcohol, it will increase your sugar level. Number eight is you quitting smoking. I did not say smoke in moderation this time around, just like I said in alcohol. Quit it, stop it instantly. Don't smoke, because that can increase your risk of having sugar level increase or even cardiovascular issues. Then number nine is seeking for necessary medication, especially for those who are at risk of having type 2 diabetes. Most times, if you know, keep those medications aside. When you check your blood sugar level and you know that you are not curtailing with your lifestyle is not okay, you smoke, you drink, you don't exercise, you practice a daily lifestyle, keep those drugs. beside you in case one day if your blood sugar shoots out, because you know you inherited it from your family member. If it shoots up, you can take the medication and then calm your nerves down. So that is it for prevention of type 2 diabetes. Now we have to move into management, and management is when you have already have blood sugar in your system, like your blood sugar is high in your system. Now, managing of type 2 diabetes involves lifestyle changes, good health diet, regular exercises, and monitoring of blood sugar level, like regular monitoring of blood sugar. Now, let's start with healthy diet. When it comes to healthy diet, you have to work with your dietitian in this time around. And your dietitian will tell you that it involves you taking food high in fiber, which involves a lot of fruits, vegetables, whole grain, lean protein, nuts, and so many other type of food. I'm not a dietitian, I'm a nurse, so I wouldn't know much regarding that aspect. That's number one. And then number two, carbohydrates. High intake of carbohydrates is not good because it contains what sugar. If you break down carbohydrates, it will give you what sugar. So your dietitian will tell you that you have to curtail in the amount of carbs that you take. Then number three is you limiting intake of sugary food, limit intake of snacks, all these beverages that has high calorie like Coke, Fanta, Sprite. So look for water and low containing calorie drinks and take, because that can help to what? Reduce your blood sugar level. Number two is regular exercising. Just like I said before, you should engage in regular exercising. If it's 150 minutes, 150 minutes in a day is okay for you to carry out such exercises. You can even involve yourself in some physical ones like biking, riding, running the staircase, swimming, even going for a walk and a run. It can still help. Then number three in my plate is regular monitoring of your blood sugar level. As long as you know that you have blood sugar level in your system, you should be monitoring your blood sugar level. Your doctors will tell you that you should monitor your blood sugar early in the morning first, then 30 minutes, or let's say 40, just give it 40 minutes, then you check your next blood sugar level. Just be recording it. Be recording and be noting the pattern at which it is going. If you see any changes in the pattern, you can go and meet up with your doctors and tell them what is happening. In such case, if they say that the medication is not working for you, they will give you insulin. So it's good to monitor your high blood sugar. Now, the number four in my plate is weight management and stress management. You just have to manage these two things. Manage your weight, curtail the type of food you eat, exercise, and then for the stress, engage yourself, just like I said before, in deep breathing exercises and then yoga meditation, where you have to relax your body, soul, and mind, because that will help to reduce your blood sugar level. Now, number six is hydrate yourself and get enough sleep. Be taking enough water. Be taking enough water so that it can help your kidney to filter out some of those sugar level out from your body system. And then have enough sleep. Sleep for like, ensure to get enough, like even if at least 7 hours, 7 to 9 hours sleep is okay for an adult to have, to relax your body so that you can help to reduce your blood sugar level. Number seven is going for regular health checkup. Always schedule a regular appointment with your healthcare provider so that you can go and check your blood pressure, cholesterol level, and even your overall diabetic management. And also schedule for eye examination because of complications like diabetic retinopathy. Also ensure to go for foot tests to prevent complications like diabetic foot ulcer. 8 is medication. I told you medication is very important when it comes to management of high blood sugar. So your doctors might prescribe some oral medications such as metformin, sulfonylureas, them, just to help you manage your blood sugar level. But in situation whereby those oral medications are no longer helping you to control your blood sugar level, the doctors might even prescribe insulin therapy for you to help bring it down. So this is it on how to manage your blood sugar level for those who already have high blood sugar level. So the complication, that is the consequences of diabetes if left untreated. Type 2 diabetes can lead to several conditions, especially when it is left over time without treatment. Here are the major associated conditions that this type 2 diabetes can bring about. So I'll be mentioning each consequences based on the systems you have in the body. So let's start with cardiovascular system. Increasing high blood sugar level can cause the heart to develop what we call coronary artery disease, and that can lead to heart attack, even stroke. The reason why it will cause stroke is because of the impact in the blood vessel. It damages the blood vessel and reduces blood circulation to the vital organs of the body. So that can lead to what? Stroke, especially when there is restricted amount of body blood or oxygen to the brain. Number 2, to the kidney. What high blood sugar level will do to the kidney is to reduce the kidney's function of filtration. That is what it will do, leading to the individual having kidney failure. Then number 3 is the nerve. High blood pressure will lead to what we call diabetic neuropathy, in the sense that the nerves will be damaged, especially in the leg and in the feet, like especially in the feet and in the hand as well. So it will cause what we call pain, tingling sensation, and then numbness. And most times, because of these 3 things, you will have injuries without even noticing that you have injury. Number 4 is damage to the eyes. It will lead to what we call diabetic retinopathy. How did this come about? Because of increased blood sugar in your system, it will damage the nerves of the retina, thereby causing loss of vision, which may even predispose the person to have what we call cataract and glaucoma. Number 5 is the foot. Because of the damage of the nerves and reduced blood flow to the legs and foot, most especially, it will lead to what we call diabetic foot ulcer. And now that diabetic foot ulcer will also be exposed to infections. Then number 6 is skin condition. Increased high blood sugar level will lead to skin conditions, in the sense that the individual will start having the individual will be exposed to fungal infections and bacterial infections. Then another one is the gum, the dental problem. It will affect the gum. It will make the gum to be exposed to infections. The number 8 in my plate is hearing impairment. So because of damage of the nerve, there's a possible risk of the individual having hearing impairment. Number 9 is mental problem, like the individual will be exposed to anxiety and depression because of fear that why is this thing happening to me? Or like the fact that you are worried, you're going through depression and anxiety. Then number 10, which is the final one in my plate, is there's a risk of you having cancer. Research has made it known to us that there is a possible risk of someone who has high blood sugar level to be exposed to cancer, such as liver cancer, pancreatic cancer, and then endometrial cancer, especially for the women. And so this is it for my topic today. Please remember to subscribe, like, comment if you have any question. Like I told you before, I will always come and reply. Please. Bye.